So, ever since, so after, now, I'm trying, so what this jerk, Dr. Cochran, this pervert did, is he contacted, what he did is, he put a large he put a large defamatory statement at the front of my records, even though this fucking a-hole is not my doctor, right? My doctor was the other doctor who he supervises, but when I have a doctor-patient relationship, it has nothing to do with the head of the practice. And you all know this, right? You all know this very well. If for a legal matter, if you want to sue a doctor or you want to make a complaint with the board, you go after the licensee. You have to make a complaint against a particular doctor. Usually, the head of the practice should not have been getting into my records. But this motherfucker Cochran, this pervert Cochran, he put a large defamatory statement at the top of my records, and he's not even supposed to tamper with he's not supposed to have any input on my records, and certainly not putting any defamatory statement. So he tried that. Well, he tried all kinds of tricks. So when I came in to get so he tried his best. He wrote a letter saying that I have to get a neurologist. And when I was asking them for records, they just wouldn't give it to me. And so now all of a sudden they have this urgency where I have to get a neurologist. It's very obvious. You can see the letter where he says he's repeating it that he wants me to, and he wants it done in that way where he gets to send the letter to the neurologist. See how that works? He wants to send the defamatory statement right to my neurologist. Of course, I didn't go for that. So I tried getting my records, and when I came into the office, that fucking asshole, John Cochran, he wasn't even in the office. So, so it was just some office workers, and we got along very well before. So no problem, I was going to get my records. But this fucking asshole, in an effort to intimidate me, he called the police and made a false report. Now, what's so incredible about his false report is, he basically said I was trespassing, even though nobody ever told me that I was trespassing. Now, the police came and they found really no reason to arrest me other than that, so ultimately they did not arrest me, but because the trespassing issue, it's really left up to the agent of the property. So if the agent of the property, if I had a right to be there as a patient and to get my records, so and I wasn't doing anything wrong. I was politely sitting and waiting for my records. So I had a right to be there for my records. And so, I had a right to be there. There's no doubt about it. I had a right to be there. Now, since they're the agent for the property, obviously they can decide who comes and who stays kind of thing, or who goes, whatever. But they never told me I was trespassing, or they never told me I had to leave. So nobody ever told. So they can't even make that trespassing charge stick because I wasn't trespassing. They have to tell me that I'm not supposed to be there before they can call the police and say I was trespassing. So that's the best the police found. So, but they tried to get me arrested just because I was trying to get my records. Now, what also happened is when I got my records, the office manager, what's her name? I forgot. Whatever, you can find that information. She came and she actually gave me records with whiteout on the page number. She sealed the envelope and she gave me, so she actually gave me, records with whiteout on the page numbers. So when I asked her to open it, she opened and gave, and then I'm looking at this whiteout on the records, on the page numbers. I mean, that's fraud of the highest level. And earlier, they had gone back and deleted items. So that MRI test which went wrong, which the guy committed some criminal acts against me, because there is nothing in the MRI procedure that can harm a patient except when somebody commits a criminal act or multiple criminal acts. So anyway, that doctor actually went back and removed the order for the MRI, as though no one would know that she's the one who gave that order. And then on these records, they whited out the page now, because they were trying to hide a computer generated sheet at the end. Actually, I already got this record earlier. That's incredible. So they thought I didn't have it. But that computer generated sheet, that shows the MRI test, the order for the test. So even though the doctor went back and deleted the test, the note within the actual write-up itself, the computer generated sheet at the end, what it did, it displayed that same information. So they were trying to hide that from me. I already had it, and they whited it out. So then I had to spend time to read the stuff. And what I pointed out is that doctor's old information, what the doctor wrote is that I have a hard time driving over 25 minutes. I have a hard time reading, like matching up numbers and letters, that kind of thing. So literally, I had the worst time trying to look for their fraud, and that's the problem they caused. So they made it so difficult for me to drive, and because they know. So I already drove into their office from Silver Spring to Fairfax, and then I had to drive back, and the doctor itself wrote on my records that in such a case, when I got to Fairfax, I have to rest, and only then can I drive back. But in fact, I didn't get a chance to rest, and I also had to do this additional work with my eyes. So, it was going to be a disaster if I drive home, and they forced me to drive home. So initially, that was thought to be the only problem, but now I find out that I'm having the severe heart condition, which they knew exactly what is going on. They know that even with a little bit of exertion, my heart rate doesn't move up enough to meet the demand, and there's severe ischemia, and that severe ischemia is causing permanent injuries to the heart. And they would have known that if someone is, and they also knew that the reason mine looks different than, I guess, like an 80-year-old typical kind of, really, a fat slob smoking cigarettes, whatnot, a fat slob smoking cigarettes, they would have, because being all the fat buildup, kind of a different kind of problem, and they really wouldn't be fit. But in my case, I was really fit. So literally what you have is, you have the hands, or mainly the legs, the chest, and the arms really pumping and driving the blood. So I really relied on my legs, arms, and chest helping to work my heart. And if someone is arrested, they're going to be restrained. Even in the standing position, it's going to be bad, and definitely in the face down position, it's going to be very bad. So this bastard, Dr. Cochran, this pervert, so he's literally trying to get me killed. So this pervert, this child molester looking SOB, Dr. Cochran, he's literally trying to get me killed, because so now comes not just now comes not just the issue of just the issue of having a hard time driving home and possibly causing an accident, but there was a definite issue of my heart, of actually dying, because literally this bastard and this entire Innova, they already knew exactly what's going on. So they were going to falsely get me arrested, and they were going to kill me. So literally they were going to use the police to kill me. So, so there's no doubt. So Innova is the fucking murderer. And so so what happened is Innova got down the road other doctors to pick up and do their dirty work. So I know Innova went ahead and contacted some other hospitals, and it's possible they contacted Medstar. So I think maybe Medstar may have been at it for a while. So this is one of the things I want to find out, whether it was just Dr. Dar or whether it goes more deeper with Medstar. So obviously, the first cardiologist I've seen. So when I went and I got information, off the grid, like doing a screening test or doing like a blood test with like a out-of-state lab or whatever, I got so many positive results, like this aortic aneurysm and calcification broken off from the head and being deposited in different parts of the body, and an elevated LDH value. Now, all the doctors I went to since then, even though my LDH value was elevated, they didn't check for any of the other biomarkers which you would check in heart attacks. Nobody ever ordered a blood test for that because they know they would be elevated as well. So they don't want to develop any evidence. But so that initial cardiologist, he actually releases a report without any physical exam showing. So he basically gets the bullshit history, he writes up garbage about me, and then he comes out with a garbage diagnosis. And so his garbage diagnosis references the weight and hypertension. Then I call his practice. Now, of course, even though a doctor sends someone else to lie for him, and the doctor is always responsible. So it's not just a captain of the ship issue. No, it's not the captain of the ship issue. If the doctor, because nobody's going to discuss their matters with anybody else unless it's directly commanded by the doctor. So the employee actually told me a lie, which is so absurd. The employee told me that the doctor writes down the blood pressure and the weight on a piece of paper, and then within like 15 minutes, and that's during the exam, and then within like 15 minutes, because the handwriting is so bad that the doctor himself can't even read it. Wow. So anyone tries to fool me about this bullshit about what's supposed to be on the records, I know what the fuck is supposed to be on the records. So don't give me this bullshit, you a-holes. Okay? I don't want to hear any bullshit. I know exactly what comes in the record. History, review of systems, physical exam. We know lung sounds. We know not just the lungs being, they check for breathing being okay. That's fine, the breathing being okay, but you still have to report on bad lung sounds, and I have them. I have it on tape. I have rails on tape, and it's incredible how none of these doctors report the crackles coming from my lungs, and that's an obvious heart injury sign. And I have it on tape. I use a camcorder, and it's just crackling away, right, while I breathe. And obviously I have the collateral superficial veins on the upper chest, and jugular vascular distension, periorbital edema, other kinds of facial edema, edema in the abdomen, and and there's a whole lot of unexplained weight. If you look at my weight, it looks like I'm 55 pounds overweight. At the same time, my entire body looks perfectly normal with some extra weight in the abdomen, and even that extra weight in the abdomen doesn't explain that full weight. So it's all edema. So I have all these signs. Let me continue to the next one.